channel. Hope you guys are well. I am a registered pharmacist. Today we are going to talk about DHA, HAAD, SLE, MOH exam past papers. This is our 7th lecture on this subject. We are not just cover MCQs but also discuss the reason behind the correct answer. These are the most important MCQs for Arab countries exam for a pharmacy license. So we are not going to waste our time. Precious time. So let's just get started. One, to supply the myocardium with oxygen shortly after myocardial infarction, we gave anticoagulant, fibrinolytic, aspirin or ASEI. So the correct answer is fibrinolytics. Please ignore my daughter-wise. Fibrinolytic drugs are indeed used to supply the myocardium with oxygen shortly after a myocardial infarction by dissolving the blood clots that are blocking arteries. However, it is important to note that fibrinolytic therapy alone may not be sufficient to fully restore blood flow to the affected arteries, and the other medications such as aspirin, ACE inhibitors are typically used in conjunction with fibrinolytics to improve the patient's outcome. So while fibrinolytic therapy is an important component of the management for myocardial infarction, it is not only medication given to supply myocardial oxygen. Therefore, the correct answer would be fibrinolytic, but aspirin and ACE inhibitor also are the part of the treatment. ACE inhibitors can improve blood flow to the heart by reducing the resistance in the blood vessels and decreasing the workload on the heart. This can improve oxygen delivery to the myocardium and help prevent further damages. Anticoagulants are not typically used as a first-line treatment for myocardial infarction. While they can help prevent blood clot, they may also increase the risk of bleeding and are typically reserved for patients with certain indications such as those are arterial fibrillation or deep vein thrombosis. 2. Which one of the following cannot be dispensed without prescription? Ibuprofen, doxycycline, aspirin or bisacodyl. So the correct answer is doxycycline B. So why? Doxycycline is a prescription only medication that belongs to a class of antibiotic called tetracycline. It is commonly used to treat bacterial infections such as acne, respiratory tract infection, urinary tract infection. Ibuprofen and aspirin are both over-the-counter medication that can be purchased without a prescription. They are not they are basically non-steroidal NSAID that are commonly used to relieve pain, fever, inflammation. Bisacodyl is also available over the counter, is a laxative to treat constipation. Therefore, the correct answer is doxycycline. 3. The aim in the management of uncomplicated hypertension 90/65, 130/85 or 150/95 or 180/110. So the correct answer is 130/85. The aim in the management of uncomplicated hypertension is to achieve a blood pressure reading that is consistently below 180 or 80 mmHg according to the American Heart Association AHA guideline. Therefore, the closest answer choice to the obviously B. It's fall within the recommended blood pressure range for uncomplicated hypertension management. The other option are either too low compared to the recommended blood pressure range for uncomplicated hypertension. Question number 4. Hospital on formulating drug efficacy, workload and cost are taken in concern. A, B, C, D, E are antifungal drugs available in the market. All have the same efficacy. The hospital was using drug E for a period of time. According to the following data, which drug is best to use by the hospital? A is 3.25 mg, B 14 days, 2.25 mg once daily, 14 days, 5.5 BD 7 days, 2.25 mg BD 7 days, 3.00 QID for 7 days. The correct answer is D, 2.25 BD 7 days. So why the correct answer is D? Because if you see, the question asks which antifungal drug is best for hospital to use based on efficacy, overload and cost. Provide data on the dosage and duration of treatment of each drug. Based on the given data, drug D 2.25 for 7 days has the lowest total dose and the shortest duration of treatment, which can help reduce the workload cost for the hospital. Furthermore, since all the drugs have the same efficacy, choosing the drug the lowest total dose, shortest duration of treatment is the most cost effective option. Based on the previous question number 4, the drug cost, frequency, duration: $91, 31.5, 77, 31 and 84. So which one will be the choice if the situation is same as in question number 4? So the correct answer in this case is $31.5 is D. The question asked, it is true that the drug D has the lowest cost compared to the other antifungal drug listed, and its shorter duration of treatment may also reduce workload for the pharmacy staff. However, it is important to note that the question did not provide information about the pharmacy staff or their workload, so we cannot assume that the drug D is the best choice solely based on the staffing consideration. Additionally, while drug D has a shorter duration of treatment than some of other drugs listed, it requires frequent dosing BD compared to a B, once daily, which may be less convenient for patient, may also impact pharmacy workload. Over the best antifungal drug hospital to use will depend on a variety of factors beyond this efficacy, workload, cost, including patient characteristics and potential side effect of medication. The question number 6, solid dosage form are better than solution dosage form. Because why? Accurate dose, easy to handle, more stable, faster action, A, B, C. So the correct answer is E, A, B, C, accurate, easy to handle and more stable. So yes, the correct answer is E. Solid dosage forms such as tablet, capsules, powder are generally preferred over solution dosage forms such as a syrup, suspension, for several reasons. Accurate dose, solid dosage form are generally more accurate in terms of dosing because they are pre-measured, do not require additional measuring devices. This can help reduce the risk of dosing error. Easy to handle solid dosage form are also easier to handle and transport compared to solution dosage form, which can be messy and require special storage condition. More stable, solid dosage form are typically more stable and have a longer shelf life compared to solution dosage form. This is because solutions are more prone to chemical and physical degradation, especially in the presence of light, heat and air. Faster action: in some cases, solution dosage form may have a faster onset of action compared to the solid dosage form, especially if the drug is dissolved or dispersed in the solution. However, this is not a general advantage of solution dosage form over solid dosage form. Therefore, the correct answer is E. Question number 7. Tolerance is a problem when using a nitroglycerin. Which of the following is true? Tolerance doesn't occur in young patient. Over 50-year patient doesn't develop tolerance. Dosing schedule may affect tolerance. Isosorbide dinitrate doesn't develop tolerance. Both B and C is correct. So the correct answer is C. Dosing schedule may affect tolerance. So why? Tolerance is a common problem when using nitroglycerin, also known as glyceryl nitrate or GTN, for the treatment of angina pectoris or heart failure. Tolerance refers to decrease in the effectiveness of the drug over time, which lead to the need of higher doses to achieve the same therapeutic effect. Tolerance can occur in patients of any age. There is no evidence to suggest that younger patients or those over 50 years of age are immune to developing a tolerance. However, it is true that dosing schedule may affect tolerance. For example, continuous or frequent use of nitroglycerin may lead to the more rapid development of tolerance compared to intermittent or as needed use. While isosorbide dinitrate is another nitrate drug used for the treatment of angina pectoris, it can also develop tolerance over time. So D is not a correct option. So the correct option is C. Question number 8. Arranging the electromagnetic waves in an increasing ranking in air will be alpha, beta, gamma, beta, gamma, alpha, gamma, alpha, beta negative, gamma, beta positive. So the correct answer is alpha, beta and gamma. This is the correct position. Electromagnetic waves are arranged in order to increase frequency or decreasing wavelength. The different types of electromagnetic wave including radio waves, microwave, infrared radiation, visible light, ultraviolet radiation, X-ray and gamma rays. Alpha beta rays types of radiation emitted by some radioactive substance, while gamma rays are a type of electromagnetic radiation. Alpha rays consist of helium nuclei, 2 proton, 2 neutron. Beta rays are highly energy electrons, and gamma rays are high frequency electromagnetic waves. Gamma rays have the highest frequency and shortest wavelength of electromagnetic waves, followed by X-ray, ultraviolet radiation, visible light, infrared radiation, microwaves, and radio wave. Therefore, the correct order of electromagnetic wave arranged in increasing frequency in here in gamma, alpha, beta, and the correct answer is gamma, alpha, and beta. The Grayman syndrome is due to amidron, antispasmodic agent, anti-Parkinson, or pre-anesthetic agent. So the correct answer is amidron. May occur in patient taking amidron for several years. It's like a blue-green discoloration of the skin appear mainly but not only on places that are exposed to direct sunlight. So this mean it affects mainly the face and hands. So it happen when you are taking this drug for a long time. And indapamide used in pulmonary edema, essential hypertension, angina pectoris. So the correct answer is pulmonary edema. Indapamide can indeed be used in the treatment of pulmonary edema as diuretic to reduce fluid accumulation in the lungs. So the correct answer is pulmonary edema. It is also used in essential hypertension and angina pectoris. Thank you so much for watching this video. I hope you found it informative and helpful. If you have any question or suggestion for more future videos, please don't hesitate to leave a comment or send a message. And if you enjoyed this content, please consider subscribing to my channel and turning to the notification bell so you don't miss out any future videos. Remember, taking care of your health is one of the most important things you can do yourself. Thanks again for watching. I will see you in the next video.